So the momentum is clearly growing. If AI is going to become a part of a real clinical care, we need a rigorous validation, governance frameworks, workflow integration, and translational maintenance. And that translation from innovation to responsible implementation is exactly where the field is heading next.
When we're talking about human lives and biology, there's high consequence. So in this case, you keep the human in the loop. But how would you like to start your day by coming in and saying, here's the results of all here's why we generated yesterday's hypotheses. Here's the supporting evidence for that. Here's how we structured the experiments. Here's how they were run in the wet lab evaluations in an autonomous way. And here's the result of those. Based on that, I'm now presenting this as the next set of experiments. And so if you think about that flow, and now my job as the human is to bring that intellectual horsepower, expertise, consult my peers, my coworkers, and basically decide that is plausible, we should go down this route, or maybe I should back off that one and try a different set of experiments and have it generate with some input that I give the system.
But then as we start to think about generative AI, you start to say, well, it's more about just information processing. I want to be able to take the opportunity to make inferences that are not apparent. And they're difficult for us to be able to make, just using sort of past tools and just the limitations of our human capabilities. I want to be able to say, what are those inferences that I can make that are very, very hard to see, and how do those turn into scenarios, alternative pathways, other kinds of things that can help guide my decision making in the future in ways that I couldn't be able to do.